Nina's question is, and I apologize if it's Nina or Nina, I apologize. Can LDN be used for Dupuytren's contracture? So that is a contracture usually in the palmar surface where the fingers can change their angle, and that's usually because there's been some narrowing and some scar tissue in somewhere in the palmar surface because of what's going on with the ligaments. Yes, it can be used for that. Is it super successful? Really depends on the individual, and it depends on where they're at in their contracture. So at what angle are the fingers? Have they had it for decades, or is this something that's just fairly recent? Low dose naltrexone, in my professional opinion, can be used relatively safely. It's used in combination with other medications as well. But usually the resolution of that contracture is the surgical route, usually not something that is going to resolve just with oral medications. Certainly can help reduce the inflammation, but usually that ligature has shortened for whatever reason, whether it's due to a virus, whether it's due to lack of nutrient status, whether it's an injury, whatever the source for that is, low dose naltrexone can be used, and it can also be used during around surgery. Nina writes back on Dupuytren's onset was about 6 months ago. No angle change, just thickening of the tendons. Surgery was has high reoccurrence rate. Yes, that is true. So for that situation, because it's a fairly recent onset, I would recommend, in my professional opinion, starting a low dose naltrexone oral regimen, starting low, 0.5 milligram maybe, and then slowly increase every 7 days, get up to anywhere between 3 and 4.5 milligram. Perhaps try that for anywhere from 4 to 6 months and see what happens. You still may end up going surgical route, but you've got nothing to lose, in my professional opinion. I don't see where it would be harmful, or I don't see where it would interact with any of the other processes. It's certainly going to help reduce the inflammation. And in doing that, I think you're going to see better response. Perhaps less fullness, less irritation, less pain if you're associated with that, and maybe better movement.